Hello, my name is Kendall Nicholas, and I will be speaking to you today about treating ADHD symptoms with family counseling and physical play. What is ADHD? ADHD is attention deficit hyperactivity disorder. It is characterized by inattention, impulsivity, and hyperactivity. Inattention is the inability to pay attention. Impulsivity is characterized by sudden outbursts of activity, and hyperactivity is being overactive. There is a high correlation seen with anxiety disorders in those who have ADHD. Another characterization is the hypofunction of the dopaminergic system. This hypofunction of the dopaminergic system may be highly related to the anxiety disorders seen, the inattention, the impulsivity, and the hyperactivity that characterizes attention deficit hyperactivity disorder. Now, we are going to talk a little bit more about dopamine. Dopamine is a neurotransmitter commonly associated with pleasure. However, it is involved in so much more all over the brain. To name a few, it is seen to be involved in neuronal motor control, cognition, emotion, vascular function, and event prediction. These are all observed to be affected in ADHD. Another thing is D2 dopamine receptors. These receptors are involved in the reuptake of dopamine. In brains of patients with ADHD, these receptors are overactive, therefore not leaving dopamine in the synapses. This leads to less dopamine in the brain, ultimately playing a role in the dysfunction seen in ADHD brains. It is also believed that dopamine works along with norepinephrine and serotonin. When you look at this chart, you can see how when one is abnormal, it affects things affected in ADHD, such as attention. So what have people tried to do about it? There are clinical treatments, one being methylphenidate, also known as Ritalin. This has behavioral calming and cognition enhancing effects and has been observed to act on the dopaminergic system. Exercise is an alternative to medicine, and this decreases anxiety, alters neurotransmission, and suppresses D2 dopamine receptors. It also has similar effects on ADHD as Ritalin. Lastly, one is the adventure-based counseling and Adlerian play therapy to help ADHD patients understand and deal with their ADHD-related behavior along with their family. This helps to take away the negative stigma and understanding of ADHD. This now brings us to our question. What is the ideal treatment to treat ADHD symptoms and change brain activity? I believe that if a patient with ADHD combines physical play and does family counseling, then their symptoms will be treated and brain activity will change. How will this be done? Well, first, we will collect 90 students with ADHD between the ages of 10 to 17, and they will be randomly chosen from the public school system. There will be 4 cohorts. First, everyone will take an initial PET scan. They will next take an initial survey in order to test their emotional regulation and how they feel about themselves. Next, they will have an initial impact test with gaze mapping. This is a task that tests their abstract ideas, and the gaze mapping is done in order to see how their attention span is while completing a long task. Cohort A is the control group. They do not do any physical activity or therapy sessions and only take the impact test twice a week. Cohort B, however, will be doing the long task accompanied with family therapy. Cohort C will be doing the long task accompanied with physical activity, and Cohort D will be doing the long task accompanied by both physical activity and family therapy. Cohort B, C, and D will do the long task with gaze mapping and a PET scan following their therapy sessions and or physical activity twice a week for the first 3 weeks of the experiment. For the latter 3 weeks of the experiment, they will do the test with gaze mapping and the PET scan arbitrarily throughout the therapy sessions and physical activity twice a week. This will be done to see if there is a correlation with the PET scan being done right after the sessions or if the dopamine in the changes last throughout the week. After these 6 weeks are done, all groups will do a final test with gaze mapping, a final survey about their emotional regulation, and a final PET scan to note any changes from the initial. The PET scan will be done to Observe the dopamine changes in the brain and see if there is any difference throughout the course of the experiment. There will be 11 carbon raclopride radiolabel injected in order to assess the dopamine release associated with cognitive processing. Next will be 18 fluoride phallopride radiolabel injected in order to assess the dopamine released with emotional processing. There will be dynamic scans done every 30 to 60 seconds immediately after injections in order to assess these dopamine releases. The PET scan data will be analyzed using the receptor kinetic model, the linear extension simplified reference region model, which estimates the values of the receptor kinetic parameters at different points of time during the scan. These values are then used to estimate the rate at which a ligand dissociates from its receptor in regards to dopamine. Attention will be analyzed based off of Python analysis of the gaze mapping. The emotional regulation will be analyzed based off of the surveys using a chi-square test. Impulsivity will be analyzed using the number of sudden outbursts recorded during their long task. And the correlations will be made using the Pearson product moment. These correlations being between the dopamine differences in attention, dopamine differences in impulsivity, and dopamine differences in emotional regulation. So what does this mean for the future? Well, this experiment doesn't look at how long dopamine lasts after each activity, so that could be something looked into. Another thing that can be researched is how these variables affect patients while on medication. This experiment is done on children and people who have abandoned medication a week prior to the beginning of the experiment. Also, it can be looked into whether these variables are effective on patients who have never taken medicine. And lastly, another task can be used to see if it's more compatible for gaze mapping for people to look up when they are trying to think. So there may be some error when people look away from the screen, being seen as a lack of attention instead of thinking. It is my hope that this experiment can bring light to a combination of alternative methods in order to treat the brain of ADHD patients other than medicine. Thank you for watching.